Cervical Cancer Prevention Awareness and Health Matters. Your partner in Health Matters. Dedicated to promoting awareness of both male and female issues.
Hello everyone and welcome to my channel. My name is Edna Dapper and today I will continue the discussion with cancer of the cervix. I will urge you to please join me as I spread the information and awareness creation on this subject to support basically women of all ages. Cervical cancer is the second most prevalent cancer worldwide and is the fifth leading cause of cancer deaths in women. Cervical cancer is preventable and we must do all we can to achieve this goal. Please also refer to my previous videos for continuity of this subject. The cervix, also known as the neck of the womb, is a cylinder-shaped tissue that connects the vagina and the uterus. The narrow opening of the cervix allows menstrual blood to flow out from the vagina during menstruation. The cervix has various functions as it produces cervical clear mucus at the point of greatest fertility that directs semen into the uterus to promote conception. During pregnancy, the cervix produces thick mucus which creates a cervical plug that shields the growing embryo from infection. The cervical opening widens during labor to allow the birth of a baby. Cervical cancer develops in the cervix and mainly affects sexually active women aged between 30 and 45. However, women of other ages could also be infected by the disease. The condition can only affect women with cervix, as females that have undergone total hysterectomy for benign reasons such as fibroid and have lost their cervix will not be affected by this disease. Cervical cancer may be non-symptomatic until it has reached an advanced stage. However, some symptoms that could be experienced include abnormal vaginal bleeding, which is typically the first symptom of the disease to be noticed and often occurs after sex. Bleeding could also be experienced between periods or intramenstrual bleeding and also after menopause or postmenopausal bleeding. Pain and discomfort during sex is also experienced with the disease, as well as unpleasant, smelly vaginal discharge. Most women with these symptoms may not have cervical cancer and are more likely to be experiencing other conditions, such as probably infections. However, it is important to consult a medical professional if any of these symptoms are observed. It is certain that high-risk human papillomavirus (HPV) is a major cause of cervical cancer. These viruses can affect the cervix and cause changes of cells development to become abnormal. The area where cervical cells are most likely to become cancerous is called the transformation zone, and that is the sampling area during a pap test. HPV could get into the DNA of cells in the transformation zone and cause changes to the development of these cells, making them abnormal. These abnormal cells become precancerous, and if identified and eliminated, cervical cancer will be prevented. Otherwise, they could progress to cancerous cells and cause cervical cancer. There are other risk factors that will work in combination with high-risk HPV to promote the spread and overcome the host surveillance activity, enabling the viral activity to thrive and cause cervical cancer. Such cofactors include sexual activity at incredibly young age, multiple sex partners, socioeconomic factors such as lack of access to screening programs, education, and awareness of cervical cancer. Smoking is a major risk factor because women with cervix who smoke are twice as likely to develop cervical cancer. People who are on long-term immunosuppression drugs could be at increased risk of retaining the HPV virus and developing cervical cancer. Long-term use of oral contraceptives is also an issue. Having multiple full-term pregnancies, being younger than 17 at first term of pregnancy, being overweight, Exposure to diethylstilbestrol. Age is also a risk factor, as cervical cancer is more common in younger women. Having immunodeficiency virus, which is HIV or AIDS, increases the risk of developing cervical cancer. The risk of cervical cancer may increase in women who have sexually transmitted infection alongside HPV. A pap smear or pap test is a screening procedure for cervical cancer. It is not a diagnostic process, but a test for the presence of precancerous or cancerous cells on the cervix. Cervical cancer could be picked up at the early stages by observing cell changes in smear tests before the cancer develops. Using pap tests has enabled developed countries to set up a national screening program for cervical cancer, a strategy that has instigated drastic reduction of incidences of cervical cancer in these countries. The pap test procedure starts with a smear taker who is either a medical doctor or a trained nurse, who gently scrapes away cells from the transformation zone of the cervix and send the sample to the laboratory for cytologists to examine for possible abnormalities. Detecting these abnormal cells early with a pap test is the first step in preventing potential development of cervical cancer. Cervical screening using pap test is not a check for cancer, but a check to detect abnormal precancerous changes in the cervix. It is important to be aware of the best time to have a pap test to avoid unsatisfactory results that could warrant repeating the test. Halfway between one period and the next is usually the best time to have a smear test, and please do not have a smear test when bleeding is in process. The use of any spermicide, including condoms coated with spermicide, lubricating gels, or vaginal cream, must be avoided prior to having a smear test. This is because the chemicals in these products can affect the test and render the result unsatisfactory. Undressing from the waist down is required for the test, so a more comfortable dressing may be necessary. For instance, wearing a skirt that can be lifted with the female still feeling covered may be ideal. Some women tend to worry about their smell, pubic hair, or leg hair. The healthcare professionals are not thinking about that, as they have seen thousands of genitalia that are all different and normal. Therefore, they are not embarrassed at all. The smear taker will require some information or history, such as date of birth, last menstrual dates, last smear test, and pregnancy status. There will be a requirement to lie on the back of a couch with knees bent and apart for the sample to be taken. If lying on the back is not comfortable, a convenient position will be discussed and achieved. The doctor or nurse will use an instrument called a speculum to gently open the vagina so that the cervix can be visualized. Upon visualizing the cervix, a small brush or spatula will be used to take a sample of cells from the TZ of the cervix. The smear taker could see if the cervix is normal or abnormal. Sample collected depends on the protocol to be used for diagnosis and reporting the smear test. Protocols used are either conventional or liquid-based methods. Samples are collected and transferred into a vial for LBC protocol, whilst the samples are spread directly on a slide for conventional protocol. Collected samples will be sent off to the laboratory for analysis and reporting by cytologists and cytopathologists. Cervical cancer is the only gynecological cancer that a screening program has been developed and adapted to prevent the disease. There is documented evidence in the reduction of incidences of cervical cancer in countries with robust cervical screening programs. Thanks for watching, and please like and share this video to your friends and family. And I will see you next time when I will be talking about what happens to the samples sent to the laboratory by the smear taker. I'll be interested. Thanks for watching. See you soon.